Hello and welcome. The European Union, Europe has launched a vaccine initiative, thanks to which recipients of some vaccines can now travel in and out of Europe freely. It's called a EU Digital COVID Certificate, to be more precise. Strangely or not, it includes the AstraZeneca vaccine, but the version that is not made in India or manufactured in India, and that version is called Vaxzevria, and whereas the Indian version, as you're perhaps aware, is called Covishield. So if you were indeed packing up your bags and getting ready to rush off to Europe for summer, you'll have to hold on for a little longer. The more important question is why. Why is it that this version of the vaccine, the Oxford AstraZeneca, which is invented or produced in the UK for Europe, is not being accepted? And what could be the reasons for it? Now, the reason that has been already stated by the European Medicines Agency is that this was not even submitted for approval as it should have been or ought to have been. So that is one reason for sure. So let's try and understand two or three things. One is, why is this happening? Secondly, does this mean that drugs that are manufactured in India have to be always submitted separately for testing and verification by local authorities? And is this a slip up, or is this a discrimination of some sort? And if so, then let's understand it a little better. And the most important, of course, is there any difference in efficacy, strictly speaking, from a virologist point of view? And in which context, I'm pleased to introduce my two guests, Dr. Shahid Jamil, virologist and director of the Trivedi School of Biosciences at Ashoka University. Also, Murali Neelakantan, a lawyer and former Global General Counsel at drug companies Cipla and Glenmark. Thank you both for joining me. So let me go in the reverse order and pose the efficacy question first. Dr. Jamil, to you, the Vaxzevria, which is the European version of this vaccine, and Covishield, which is the Indian version of this vaccine, or manufactured in India version, is there any difference?
Well, Govind, for Covishield, we don't know the efficacy because the bridging trial for Covishield hasn't really been published. So I've not seen any efficacy for Covishield. The only efficacy data I've seen has come for the AstraZeneca vaccine. So, according to Indian regulation, they were supposed to do a bridging trial, which I believe they've done. And but that trial is the results are not published. And what Covishield got in India was an emergency use approval based on the AstraZeneca vaccine, those results. So
Right. So we use the term AstraZeneca and Covishield quite seamlessly. So you're also pointing out, therefore, that that's not the way to do it, right?
Well, this EU passport is something very new, but the Indian regulator took a view that since the AstraZeneca, which I mean, the vaccine made at 4 AstraZeneca sites, and the, the efficacy trials done in South Africa, in Europe, and I don't remember exactly where all. The Indian regulator considered that data and gave the approval. So that is why in India, Covishield is still on emergency use approval. It doesn't have full approval in India yet, and Murali can maybe enlighten us better on that. So that's a fact. But what we do have now from India, just like we have it from UK, is real world data for Covishield, and the real world data looks just as good as AstraZeneca looks in UK. But strictly
Right.
speaking, the efficacy we don't have.
Right. Okay. So by inference, we know that the version that's available in India works as well as the version available internationally, but there is no hard data to go with at this point. Murli, tell us about, from a process point of view, what happened here.
Uh, AstraZeneca, when it applied for approval to the EMA, listed the sites which were producing this vaccine. And those sites were in Switzerland, in the UK, some sites in Europe, a site in China, South Korea, and the United States. So at that time, when it applied for approval, it produced the data to the EMA for approval of the vaccine. There is no data from Serum Institute's facility that was submitted. Therefore, it is not listed as a site from which this vaccine can be produced and sold in the European Union. So that is the situation now.
Right. So no, that obviously opens up another a can of worms, so to speak. So are you saying that, first of all, who's the principal here? Is it AstraZeneca or is it a Serum Institute? Because people are asking Serum Institute questions, and Serum Institute is a contract manufacturer for AstraZeneca. Isn't that right?
That's exactly right. And that's the reason why, if Serum had no intention of selling these vaccines in the EU, it would not have any incentive to go and apply by itself for approval of this drug in the EU. As far as I understand it, the license from AstraZeneca to Serum Institute does not include Europe as a territory. So Serum does not have a license from AstraZeneca to manufacture this vaccine to sell in the European Union. And therefore, it may not have considered it necessary to even seek an authorization. Why should it?
Right, but the person who applies for these licenses is the person who holds the original patent. Am I right? Or can a Serum Institute, who's a manufacturer, also go and apply?
If the manufacturer intends to market it and sell it in the European Union, then it would have applied for a
Oh,
license. In this case, since it never intended to and the license didn't permit it to, it perhaps had no reason to go and apply for a license, for an authorization in the European Union. So AstraZeneca did not intend, perhaps, for Serum to manufacture a vaccine and be sold in the European Union. Therefore, again, AstraZeneca didn't see any need to include the serum manufacturing facility during the application for approval.
right. Okay. So now two quick questions. So one is this what happens usually when any drug is also manufactured in India? Like we do have so many cases of drugs that are, yeah.
So, there are two scenarios. The manufacturing authorization, the marketing authorization, could be held by one entity. It could be subcontracted for manufacture to India, but the authorization is still held by, let's say, a European entity. That is one scenario. The second scenario is the manufacturer intends to market this drug in the European Union, has rights to sell it in the European Union, and therefore could also be the marketing authorization owner, the MA holder in this case. So there are two scenarios possible.
Got it. Okay. So now, how long could it take? Now, today, assuming if let's say Serum Institute or AstraZeneca with Serum Institute go and apply to the European Union, saying that here is a drug that we may not sell in the EU, but we want approval so as to allow those who are vaccinated in India to travel to the EU. So, how long would that take in a normal situation?
It depends on what data they have. So if they have done a trial, they have batch records. So the manufacturing records are there. The QA records are there. The testing process is there. Protocol is there. That data is there. Now, do they have clinical data? Have they done enough clinical trials to say this is the same or this is the same product? So I don't know if they have enough data. And that process, there is no time limit for it. I suspect it could take a few months if they applied for it and they had all the data. But there's no way of saying, give it to me today and you can have it tomorrow. So I don't know what data Serum has that is enough for a European dossier.
Got it. Okay, let me pose the. I'll come back to this in a moment, but let me pose the larger question, Dr. Jamil. So, if you were to look back now at the last year and the way, let's say, data is being generated, including on trials, what's your sense? I mean, do you feel that we have sufficient data, or to understand how this vaccine is working, or do you see gaps? And if so, where do we fill them, and how could we fill them?
Well, what we have is Covishield has been given to about 280 plus million people in India. So that's a hell of a lot of data, uh, compared to what you do in a clinical trial. What you won't have is efficacy, because that's done in a controlled trial. But what you have is vaccine effectiveness, which is the real world data on vaccines. So I think you know that data should itself stand, uh, but of course I'm not aware of the legalities here. Just on the basis of you know being that vaccine given to 280 plus million people, uh, and showing reasonably good protection in the real world, uh, it should qualify.
Right. Okay, so let's attempt that question then, or rather, I can attempt the question, and I'll ask you to attempt an answer. So, going by what we've seen in the real world, in the sheer number of people that have been given this jab, and the fact that it's largely been, or at least from my perspective, it seems to be that it's working. Is that enough for countries to now say that okay, we've had some success in the vaccination program? Not in proportion to population, but in proportion to the number of people who've been given this.
You mean India's
Yeah,
vaccination program?
yeah. The
Sir.
vaccination program and its efficacy in terms of those who've got it.
Yeah. So what the data really shows is that people who have taken one dose of the
Right,
vaccine
right,
get roughly 70% protection from hospitalization and severe disease.
right,
Those who have taken both doses, their protection from severe disease and hospitalization goes beyond 90%. Now, the trouble here is that two kinds of data are at this point available from India, but neither of them classify the vaccines as the data into Covishield and Covaxin. One is a study published by Christian Medical College Vellore,
Yeah.
which came out in the Mayo Clinic proceedings, uh, which doesn't, partition the data into Covishield and Covaxin. They are simply saying that since 90% of the vaccine is Covishield, and we didn't have enough Covaxin recipients to really achieve statistical significance, therefore most of it is Covishield. Uh, the other data which has just come out in the Indian Journal of Medical Research is vaccination of people in the Tamil Nadu police department. And that clearly shows there the end point is mortality. And that shows that for people who have not taken the vaccine have a certain level of mortality. Those who have taken one dose have significantly less, and those who have taken second dose are much, much lower. So if the risk is one for those who have not taken the vaccine, the risk is zero point zero 0.05 or 20 times less, but that's measuring mortality. Again, this study doesn't say whether people got Covaxin or Covishield. So that's the real world data available from India.
right.
The real world data available from Public Health England and from Imperial College and Warwick and several places in the UK are all with AstraZeneca. They're not with Covishield. So that's the technicality, I guess, uh, in this.
Right, and I'm going to come to that technicality moment. But if Dr. Jamil, if you were on the other side, purely hypothetical question, let's say you were sitting outside India, maybe in Europe, and looking at this picture that you've just painted of India, would you say that it would be safe to allow people to travel from India into Europe, assuming all other factors are constant? That is, those countries have been opened up to a certain point, and they're allowing people from other countries apart from India.
I would, uh, because in the real world, the vaccine is protecting. I would. Uh, but then, if you were to say, would you allow on the basis of this data for Covishield to be sold in EU? That's a whole different ball game.
Right. Okay. Murli, let me come back to you now. So, in the case of vaccines, and obviously there are a lot of I wouldn't say corners have been cut, but definitely things have been speeded up. Now, in the real world, again, given the fact that this is how the vaccine is rolling out, given the fact that some things have to come back to some degree of normalcy, could let's say organizations or regulatory organizations move faster for granting approvals, or let's say maybe giving a certain pass when it comes to maybe a specific approval, like in the case of the European Medicines Agency?
I don't think it is likely that the EMA will now look at this data. I think there are like two other likely scenarios. One is the European Union, rather than the EMA, which deals with the free movement of people, will advise member countries that in addition to the four vaccines that are approved by the EMA, all vaccines approved by the WHO will be treated as if they were approved by the EMA, not for the purposes of authorizing it for sale, but for the purposes of travel. So, this is not an EMA approval of the vaccine. This is just the EU saying those who've been vaccinated with the vaccines approved by the WHO will be treated on par with those who've been vaccinated by the vaccines approved by the EMA. So they're two separate issues. And I think this is a more likely pathway than the EMA approving the vaccines approved by the WHO. So I think that is one scenario that is possible.
Right.
The other scenario could be, and don't forget, it's not just India. We're talking about Covishield to about 90 other countries under the COVAX program. We've also shipped this to Australia, we've shipped it to the UK, we've shipped it to Canada. So it is not just an Indian problem. We have people potentially from all over the world who are affected by this restriction on travel. So I think the second scenario could be that each of the member countries decides for itself that it will treat certain vaccines approved by the WHO on par with the vaccines approved by the EMA for the purposes of this travel. I think the second is more likely because countries like Hungary have had Sputnik and Sinopharm, neither of which is approved by the EMA. So, if they want their own citizens to be able to travel within the EU, they will have to agree with the EU that Sinopharm's vaccine and Sputnik V are to be treated on par. So, it is in the interest of Hungary to then lobby the rest of Europe to
Right.
find this as the way forward.
Right, and I'm going to come to a larger question in a moment, but you're not seeing anything so far, Murli, in discriminatory in this. I mean that it's being manufactured in India. We maybe don't have so much oversight on those facilities, and therefore we are not sure, because that seems to be the suspicion in some cases.
Not at all. As I said, nobody's picking on India.
Okay.
The Indian facility wasn't ever considered. No data was considered, no application was made. So you can't say that somebody's been excluded if you're not even knocked on the door yet.
Got it.
So this is not an issue of racism. It is just there is a rule book. You should have applied for approval or authorization in this case, and you didn't. So how can an EMA authority grant you an approval when you've not even applied for it? You've not presented a dossier.
Right. And the reason it was not applied, you're saying is okay, one is because no one thought of it. And so is it as simple as that? No one thought of it, or is it a little more serious? I mean, you should have thought of it, but
Uh, no, I'm sympathetic to the fact that nobody thought of it last year.
okay.
I'm less sympathetic of the fact that nobody thought of it in January. When the Green Pass program was conceived in January, it was open for consultation. We should have engaged with the European Union, knowing that a lot of Indian citizens will want to travel to the European Union. We should have worked with other countries which are going to receive Covishield to present a united front to the European Union to say, you're going to have a green pass system. How can we participate in it? Countries outside the EU have done it. So Iceland has done it, Liechtenstein has done it, Switzerland has done it, Norway is doing it. So there are countries outside the European Union which have understood that their citizens need to be traveling to the European Union and have engaged with the European Union. They have built an IT system, integrated it, and tested it with the European Union so that you can now have this process working on the 1st of July. So I don't have any sympathy for the government. So I think I have some sympathy for why we didn't engage with the European Union on this last year. But in January, the European Union announced that it was going to have a Green Pass program. There was a widespread consultation on this. We had a chance to engage with them to understand how it will work. All the members of the European Union had a discussion. Some outside the European Union, like Liechtenstein, Switzerland, Iceland, also participated to understand how it is that their citizens can move within the European Union. And so at that time, the Indian government, with other nations of the world who will be vaccinated with Covishield, the United States, Australia, and the United Kingdom, could all have had this discussion with the European Union and said, this is an
Right.
issue which is not only for the European Union, it affects a significant part of the world, 100 countries around the world. So how can we work with you at an early stage so that when the Green Pass system comes into effect on the 1st of July, we're already in it.
And these discussions are led by whom in a country? Is it or you? I mean, you tell us.
The European Commission starts off on this, and each of the countries is discussing this because the systems are not set up by the European Union. The
Right.
certificate
No.
itself is issued by the national authorities. So they all have to build systems to work together with the European Union.